Hello, I'm Dr. Han Fu Chai, an orthopedic senior consultant in Mount Elizabeth Novena Hospital, Singapore. This is my first YouTube video as an extension of an article I've contributed last year in December 2022 that can be found online. Why you might need to take that weight off your shoulders. Don't ignore the persistent pain in your shoulder. It could be a sign of rotator cuff injury. Many of us would have felt shoulder pain in our life. Muscle aches usually recover in a few days. However, if pain, stiffness or weakness persists, then it could be a sign of rotator cuff injury. The rotator cuff is a group of 4 shoulder muscles that is needed for moving the shoulder. It is essential because it is used in many of our daily activities and sports. The most common symptoms include pain and weakness when lifting the arm above the shoulder level and rotating the arm, such as reaching around the back. Rotator cuff tears can be due to an acute injury such as a fall onto the arm or from prolonged and repetitive wear and tear. Initial strains and sprains can progress to tears. Therefore, it is key to identify a rotator cuff injury as early as possible. We can diagnose this condition with clinical examination and ultrasound or MRI scans. Prevention is better than cure. There are steps you can take to reduce the risk of sustaining a rotator cuff injury. Such measures include strengthening and stretching exercises to improve flexibility of the muscles, adequate warming up of the shoulder and arm muscles before sports, sufficiently resting between strenuous activities. Do not ignore shoulder pain. You should stop performing any activities that trigger pain and seek medical treatment if the shoulder pain persists. The treatment options for rotator cuff injury varies depending on the severity of the injury. Treatment options include modifying activities that triggers or worsens injury, activity modifications that include avoid placing extra stress on the shoulder that can aggravate the injury, adopting good posture to maintain shoulder blade in the right position, avoid carrying heavy bags over the affected shoulder, and avoid repetitive overhead loading of the affected shoulder. Painkillers and medications to reduce inflammation, physiotherapy, steroid injection to reduce pain and inflammation, or platelet-rich plasma, also known as PRP, injection to stimulate healing. Generally, we will try non-surgical treatment options first, depending on the severity of the injury. Keyhole rotator cuff repair will be the last resort if non-operative treatment fails. A small camera will be inserted into the shoulder and it will display a live view of the shoulder that will guide us during the procedure. The tendon is repaired using biocompatible plastic suture anchors. For more information about your shoulder pain, please contact me as shown below. And please remember to subscribe to my YouTube channel for more upcoming videos on our body and associated injuries.